public access is your best bet. Watch whenever you can. Well, thank you for joining me. This is the Education is Best Medicine, the Medicine Hour. So it's a component of Education is Best Medicine that was developed under the leadership of Ms. Howard, Conscious Voices. I want to thank her again. I want to thank everyone for being who you are and coming out and checking us out. I want to talk a little bit first about a benefit for the Alameda County Food Bank. It's going to be on November 16th, and it's at the Henry J. Kaiser Center at 10th Street. It's called Feed the Bay Laugh Fest. It's one of my good friends, Earl, who's the major architect of this. We've been talking about it back and forth. Was hoping to have him on the show, but just schedules couldn't connect. But we want people to kind of support the food bank of Alameda County. This is a comedy fest. Again, it's called Feed the Bay Laugh Fest, and it's going to be on November. So you can search it and pick it up through that. That's how I did it also. Want to kind of have some discussions about health and smoking. And I guess because I've been having such a number of patients come in, I'm seeing with all ages spectrum with this discussion around smoking and smoking risk and just seeing a lot more women, a lot more older men trying to quit having smoked for a number of years. So again, I want to have this discussion. Again, it's like 40% of the things would reduce a number of our risk of cancer. Smoking is primary, and that's why I want to talk about it today. And more so, not just smoking, but toxicity and independent and tobacco dependence. And so I think this marks the physical nature of smoking and why it's such a devastating disease. Devastating addiction. And I think that I want to include that part because we just talk about with smoking, and what I want people to look at these effects that are cumulative over a number of years. So you start smoking in your 20s, as one of my most recent clients did. He was in his teens, and in his late 60s now he's trying to stop. So that's the addiction in terms of cost, in terms of effect on the body. Particularly, we'll talk about heart, lung, cardiovascular risk of cancer, chronic issues, and in particular for women also. So I think that because more young women are smoking, so again, this is a discussion that we have to have, and it seems to be a line drawn in terms of economics. Folks that are poor and should be less smoking, are smoking more. So that's kind of what I want to have a discussion about. So again, tobacco was first discovered in Mesoamerica and in South America, and that's like some major archaeological evidence suggests that humans, the Americans, began using tobacco as far back as almost 12,300 years ago. So, and I think even this is a worldly drug, and there has to be an amount of ritual attached to it, and amount, again, of pleasure attached to it, and the marketing of it in our case now in modern Americas. And so the plant is known as Nicotina tabacum. I'm masquerading, but it's Latin, and it's been used again in ceremonial, medicine, social context long before it was introduced into Europe. So this goes again back to Africa. It goes back to all these issues that we're able to procure this product and then start to use it. When European explorers such as Christopher Columbus arrived in Europe, it quickly became popular. So this is a discussion from but I searched AI and asked the question about, origins of tobacco. So, and so this is a widespread and a significant cultivation of tobacco, then spread globally, become a significant economic and cultural commodity, particularly in the Americas. Tobacco was a slave crop. Tobacco, cotton, these were slave crops. This what was raised. This made money. The plantation, cotton, sugar. I mean, cotton, tobacco. The cultivating practices of Africans made, these white slave owners rich. So the understanding of tobacco as a long-term use product in the Americas and its Americanization, its feminization, its masculization, gets us into the discussions around not only tobacco dependence, but also toxicity. And I wanted to think about it in terms of poisoning. So I went to the literature on poisoning and kind of picked up some interesting data. There's almost 70,000 cases of nicotine exposures reported that's up in terms of up to date. And the toxicity issue is more pronounced in those that vape than those that smoke. I would also add that the exposures to children and animals and partners makes this equally distressing catastrophe, because people that don't even smoke are being exposed to tobacco and tobacco products, and it's affecting them, particularly children, in terms of asthma and respiratory problems, and particularly to the older adult partners in terms of cancer, particularly lung cancer. And again, a lot of the cigarettes are nicotine based, and there, I guess the issue is, in contrast, exposure to nicotine products, most commonly tobacco. Nicotine tobacco is infrequent, so you have more risk now of vaping and having a issue with toxicity or poisoning than you do smoking. But understand this is over time. Again, that 20-year-old person that ends up having smoked for almost, to their late 60s and wants to quit. So there's the discussion around the slow process of how these drugs do ultimately poison individuals and change the quality of their lives through chronic illness, particularly cancer, particularly lung diseases like COPD, chronic obstructive pulmonary disease, asthma, respiratory problems, and bronchial infections. So again, vaping seems to be the issue in terms of poisoning. But again, I say over time, the same effects happen. In terms of toxicity, nicotine binds to particular receptors in the brain, in the spinal cord, and then in the nerve and the muscular junction. So this is a global drug in the body. And also, I would add to the vasculature, changing the diameter of the vasculature, destruction of it. And also, there seems to be some indication that it also accelerates coronary artery disease in terms of arteriosclerosis, which is hardening the arteries and with a fat because of whatever issue, pressure, heat, inflammation, gets free through the vasculature and can travel to the brain, the eyes, the heart, the kidneys, and cause havoc. And the major neurotransmitter seems to be acetylcholine on these receptors. So it's a agonist kind of drug, which means that it hits the receptor and stays there, and it has to be removed off. It has to either the level of the drug has to drop, or it just, again, it has to dissipate. And some of the issues with nicotine toxicity, examples, things like sweating, are sympathetic, which is the fight or flight system. So again, when people smoke, the heart rate goes up, they breathe faster, they sweat more, they're more nervous, more anxious, or the opposite, depending on the effect of the drug. And again, the level of exposure and the level of absorption and the level of, contact, it can be absorbed in the eyes, it can be absorbed in the nose, of course, of the lungs, the skin. Those are some of the discussions about how tobacco disseminates to the body. And it affects, various systems and sweat glands, and creates a fast heart rate. Again, this is in toxicity range. But think about this over time. Hypertension, right? Person starts smoking in the 20s, all of a sudden, either genetically or inadvertently through the weight gain, and all of them, they have hypertension. So the hypertension is more maximized on a person in smoking. And again, the sympathetic stimulation, the fight or flight symptom, in terms of bronchial spasm, increased salivation, vomiting, diarrhea, and this can happen on the onset of using a drug to toxicity or from withdrawal. So you could have both events. That's why stopping smoking is so hard, because people are afraid of withdrawal of anything, even food, right? Changes in vision, pupils, and also muscle changes, fascicular contractions, to the point of agitation, to the point of tremor, to the point of even seizures. And so again, this is the discussion around toxicity, and also which reflects the issue around why people are dependent, because they don't want to have these things happen. Particularly when I worked in the military, saw that there's an issue around, smoke if you got it was okay. What cultures benefit from a person doing this or doing that? Well, you send a person to war, at least they can have a cigarette, right? So, and again, there's pericardial muscular contractions, paralysis, loss of breath, heart problems, breathing, apnea, and even to point of coma again. But think about this over time. Think about this over a 20 or 30-year period. In small microdoses, a person continues to smoke and to build up a tolerance and to build up a level of toxicity in their bodies. Remember, it affects the central nervous system, the brain, the heart, the muscles, everything, the bladder. And so, and again, with the ultimate issues in terms of heart changes, heart arrhythmias, hypertension, which can lead to progressive changes of the heartbeat to a point that would stop beating. And toxic doses aren't that much. For a child, it's 1 to 2 grams of tobacco. And that could be 3 butts of cigarettes, it's not a large amount for a child. For adults, and if they don't ever smoke, it's 4 to 7 milligrams, with the maximum being 60 milligrams to levels of toxicity. This is Believe Radio, 24-hour inspirational and gospel music station. I'd like to thank Adamaji. He's still birthday's over. Is the birthday's over? Birthday's almost over. So he said he's going to go out with a bang. And I want to thank Curtis for opening up the station and keeping things running. Again, I want to thank all of you for watching. I'm emphasizing, please go vote. Vote like your democracy depends on it, because it really does. So what I want folks to understand, tobacco as it is now, as it's used as a product, as cigarettes, as vaping, as smokeless, as chewing, think about all these forms, and think about it government regulated. which means it's authorized that you can use it as a product. It tells you it can cause cancer. It can cause health effects. It's $12 for a pack. That's a lot. And the exposures, right? Exposures to the skin, the eyes. Again, in inhalation ways, the products can get inside the individual, And I think that, again, get back to the marketing. I grew up in the Marlboro Man era, and all the really cool movie characters and spies all smoked. And if you go back to my dad's generation, which is, I like his generation, so I watched guys like Clark Gable and John Wayne and Sidney Poitier and Harry Belafonte and Ivan Dixon, bless his soul, he just passed, and John Amos, bless his soul, he just passed. These are the men that I watched, but I don't even think John Amos smoked that much. But anyway. But that's the imagery that's placed on us in a community. Cool cigarettes, menthol produced so that they particularly appeal to African American buyers. Peppermint. I can remember it being boxes of peppermint candy. And that same taste was in cool cigarettes. The gear, all the gear, my height or higher at that time. You get a camel jacket, you get Marlboro boots, right? So I'm talking about this because my father died of lung cancer. He was a little smoker. I was I think in my late 40s, late 50s when he passed, and I could never think or see him without a cigarette in his hand. Never ever not going to get his carton of cigarettes from the Army commissary, which had a really good milk at that time. That's whatever they did to the milk, I loved it. And he was a working man, blue collar guy, rode the bus to work late hours, double shifts, in a very racist environment. Both of the men in my life, Jimmy Lee Smith. So, and my uncle smoked for a time, then he stopped. I was very proud of him. You watch and you see the men in your life, me and men in my life, and what they did and what they had to accomplish, what they had to overcome. So please give me your prayers to my son as he tries to find his way in this maze called America. But the exposure to tobacco, to the skin, to the eyes, again, the inhalation pathways, and referred smoke, smoke that, the individual gets from a family member, from a work situation. Those are things that I'm concerned about because they get cancer, they get, respiratory problems, and they weren't even smoking. And again, and it seems like the new vaping products as more accessible. The young children are getting them and having the major poisoning episodes from the products. Again, it's not cigarettes anymore; it's these vaping products or the solutions also. And for the folks that become symptomatic, 20 to 30%, because some people don't have any problem. And it was my understanding that that's what I'm getting to, because again, for the majority of the folks won't have any evidence of tobacco toxicity, but they will have evidence of tobacco dependence And as they try to stop, they understand they are addicted to the product. And so I think that's one of the things that we need to kind of watch and be okay with, and helping people make changes, because you have to help. This is just not. And we'll talk about things we can do to help folks, and some of the things that I think clinically are happening. So from use to dependence to poisoning. And again, a majority of folks won't have any problems. They'll smoke for a number of years without having any problems. But 20 to 33% of persons can have nicotine exposure, will become symptomatic. And it can start to increase salivation, drowsiness, in children, hyperactivity of the kids. They're fussy, hard to console, and fast heartbeat, changing the color of skin, sweating, dizziness. And that's just mild, right? But with moderate problems comes with poison comes hypertension, squeezing, fast breathing, bronchial hyperactivity, lung spasming, fast breathing, repeated vomiting, diarrhea, tremors, muscle, physical circulations, ataxia, you lose your balance, confusion, agitation. All these things happen as a point of poisoning, and it's a medical emergency, particularly in a child. But again, for the majority of us, we're talking about over a 20 or 30 period that this moves from dependence to poisoning, or it moves to a significant issue like lung cancer or chronic obstructive pulmonary disease. And the reason that I thought this was important, because we're having more young women smoke and drink, and drink hard liquor. And so it could cover a broad spectrum, which includes arrhythmias, cardiac arrest, hypertension, respiratory failure, seizures, coma, and of course, ultimately death. And I think, again, get the family member to a hospital, and get them stabilized. Airways have to be protected. This is not something you can do yourself. They might not get better, and if it's a child, definitely not going to get better. They need to be evaluated. That's what emergency rooms are for, to evaluate the lethality of the discussion, particularly with a child. So I think that all these things lend us to understand why we want people stop smoking, and move to discussion of treatment. And and even with the exposure, you want to kind of ask, how did it happen? What were you seeing currently in terms of signs of toxicity, in terms of that loved one or the child? Again, hyperactivity, fast heartbeat, not responsive, fussy, their child. We do vital signs, and and again, it's breathing, heart rate, protecting the airway, and identifying any other causes too. So this is poisoning that's went to a level that 20-30% that needs to be under the care of ER for any issue, intubating, protecting the airway, addressing cardiac arrest issues, seizures, and making sure no other products are involved. And again, tobacco interacts with a number of drugs: caffeine, clozapine, which is a mental health drug, pristazine, naloxone, again, propranolol, theophylline, And if you're taking insulin, tobacco alters the insulin dose. So you may need more insulin, right? What more if you're a diabetic? That's why you should, as a diabetic, you should be smoking, because it alters your insulin dose. And the major thing that I always concern myself with in terms of these any kind of drug toxicity is cardiovascular issues. What effect on the heart? What effect on the brain? What effect on the lungs? And the major effect of nicotine is on the sympathetic system in the heart. And again, the sympathetic system is our fight or flight. So you send your heart into either fighting or running, which makes it beat faster. It's under duress, makes it under duress. Yeah. And that's what happens when you smoke. When you smoke a cigarette, whatever time of the day. Early in the morning seems to be a real big issue. After dinner, my dad always smoked after dinner. And it affects the central nervous system, the brain, the spine, the nerves. And it's a vascular drug also. Also causes thickening of the blood. Now, this is why we want people to stop. The effects of tobacco are global, always affecting the heart, usually in an adverse fashion. And says smoking, cardiac risk. Smoking is an important established risk factor for myocardial infarction or heart attack. Other coronary events include chest pain, angina pectoris, with a sudden cardiac death. So this is why we want people to stop smoking. It's just too many risk issues involved. And this is saying that you don't have any other problems. You can still have a heart attack. You can still have sudden cardiac death. You can still close your coronary artery stemming off. You can still have stroke. You can still have aortic aneurysms. And I was thinking about this talk because as I was seeing this particular patient, I had to order all these studies. I had to send them to a couple of specialists. I had to send them to cardiologists and the pulmonologists. He needed an ultrasound for a AAA, which is a abdominal aortic aneurysm, and he's a smoker, so he's at more risk for that, and those things can bust. My dad had one. It required endovascular surgery where they take this system, this kind of like a sheath, and they run it through the aorta and near the aneurysm, which was over 5 centimeters. It goes between 3 and 5 centimeters. Once the aneurysm gets to 5 centimeters, it's either a surgical issue or what was done with my dad, an endovascular process that shrunk the aneurysm. Otherwise, it blows up like it did in Einstein and kills him. So, why we want people to smoke? Because it's easier to stop smoking than it is to go through that process and survive it. So we think that smoking just starts to accelerate a whole bunch of negative chemicals in the system. It causes increase of free radicals. It increases lipid conversion. So if you have fatty blood, if you have elevated cholesterol, this fat that it makes that fat more liquidy and more movable around, and increases inflammation and also affects the vessel, the endothelial layer of the vessels, causing it to either shrink or dilate or become dysfunctional, closed off, that kind of thing. Smoking increases work on the heart, and it's just a product that has so many implications to one's health and one's family's health, that it just has to be taken a look at in the context of a adverse life outcome when a family member living together, all the family members are smoking. Because if they're smoking, they're eating probably in a particular way, or they're drinking in a particular way, or they're eating and drinking in a particular way, and not getting enough activity, that kind of thing. And so cigarettes increase the work of the heart and a rise in the blood pressure about 5 to 10 millimeters. And the effect is most prominent with the first cigarette of the day and individuals who smoke all the time. So again, this raising of the blood pressure, this oscillation of blood pressure up and down, heating the vasculature, moving more plaques, causing inflammation, decreasing vascular diameter, causing more inflammation, making the vascular bed a setup for a destruction in terms of injury, as well as occlusion, as well as decreased blood flow to the brain, the eyes, the heart, the kidneys, everything. And that's what you're looking at. And again, it's true that in the first years of smoking, people have a lower blood pressure than those smoking and those that don't. But over time, it averages out, and the folks that are smoking, blood pressure rises, and they're more prone to events. This is all silent, right? Unless you're having nicotine toxicity or poisoning, you don't feel this. You don't feel it. There's nothing to feel. And so there are some great medicines for stopping smoking. And I would say that please talk to your provider about smoking and smoking cessation. Talk to your provider about this in general. This is not medical advice. This is reviews of the literature, and this is what the literature says. I try to use that sources like UpToDate, ProMed, Medscape. Those are the sources that I use in order to put talks like this together. And so what comes to mind, not only is the pharmacology, but behavioral therapy and counseling in regards to smoking cessation, because you have to understand the triggers, understand why you smoke, the trauma involved with the smoking, before you can really address those things that have you smoking in the first place. In other words, for my father, it was food. After dinner, after breakfast, he'd have a cigarette and a cup of coffee. Now I have a cup of coffee, but I don't smoke, because that's what we did as a family. That's what I watched him do. That's what he did. So a lot of this is about behavior and the ability to change behavior. And all people have to be ready to quit smoking before that behavior can take place. If people don't think there's a problem, then they're not going to stop. If it doesn't affect the quality of life in a negative way, then why would they change? If it's not hurting me or I can't feel it, then again, these are all the excuses that people make for smoking. And I'm hoping to paint a picture of saying that the use of tobacco has global implications on one's health. And if there's one thing you can do, again, 40% of cancer can be prevented by doing like 4 simple things. And one of the primary is to stop smoking. So there are a bunch of behavioral techniques and counseling programs. Uh, common is a cognitive behavioral therapy, and a lot of this has to do with looking at the behavior, understanding why you are engaged in the behavior, what are the benefits of the behavior, and what are the negatives of the behavior, and how can you create a plan to change what you're doing. Because ultimately, that person has wanted to create that plan. The suggestions to get into, brief psychotherapy, I will be making referrals for folks because you need help in developing techniques to stop smoking. You just can't do it alone anymore. Yes, there are a lot of people that stop. My stepdad stopped. He just stopped. He just stopped. And that was really kind of interesting because he had smoked a long time too. He smoked in the military. He smoked in some other places too. Um, Handsome guy. And sometimes the clinician isn't thinking about the mental health aspects of smoking. And we're too busy on prescribing Nicoderm or the Wellbutrin or the Vaseline, Versaline. But in reality, this does have to be a discussion around the um, thoughts and wishes and behavior of an individual, particularly as it relates to women, because some of this is hormonally driven, and so that takes away one of their tools. Again, as women are aging, I'm going to end the show with talk about menopause because October is menopause month. And the issue around identifying triggers for the smoking, and because again, you go and see the provider, and he says you need to stop smoking, and you're smoking for X amount of years, and you got 15 pack years, and that constitutes you at least to get a spiral CT scan for lung cancer. And in my case, I would see a pulmonologist. Again, heart lung issue, you have to have it looked at that long. And identifying triggers, again, whether it be food or sex or drugs or situational or work, and what are the better ways to cope with this. And there are a number of websites. Some resources are Great American Smokeout, smokefree.gov. Again, smokefree.gov, easy one. The Great American Smokeout, National Cancer Institute, and these are websites I think that have some very good suggestions for individuals who want to stop smoking and to engage their provider, again, back to the provider, and aspects of what the people can do to stop. Because again, the issue is withdrawal. The issue is that feeling of not being able to go to the cigarette when you're anxious, when you're upset, when you're hungry, when you just had a meal, when you just had sex. And how it functions in terms of support, families, friends, partners, everybody has to be supportive. It's just like alcohol. If everybody's drinking, no one's going to stop. And the people that want to stop drinking get ostracized because they're not a part of a larger group. So again, this is an individual decision. So an individual has to make a decision that this is no longer consistent with how I want to live. Again, this is Believe Radio, 24-hour inspirational national gospel music. We'll also thank Dr. Lenore, Michael Lenore, pediatric allergist in the Bay Area, and his wife, Mrs. Lenore. I want to thank them both for accepting me and working with me and enjoying the work Dr. Lenore and I are starting on this media aspect. So look forward to another aspect of media production from Education is the Best Medicine in collaboration with Dr. Michael Lenore, who has a major media presence and going to be working with him in regards to assuming some of the roles of Black org, Black Doctor Org. So I'm really excited about that. So they, when you want to talk to people about, and what I try to do is talk to people about, in terms of stages of change and the issues around relaxation techniques, supportive therapy, getting people to change their mindset about smoking, and it's a process, and that's what I'd like to and try to do. This is going to be an interesting month. This is some of the things I think I'm thinking about covering is the positive attitude month. This is October, right? Tackling hunger month, vegetarian month, National Learning Development Month, National Dropout Prevention Month, Breast Cancer Awareness Month, and World Menopause. And as I said, please go vote. And so to start off, or to end off, I want to thank everyone for watching. I want to thank you for tuning in. And again, as we start to expand the platform and get more tight, and hopefully you'll be going to the website educationsthebestmedicine.com to view what we're going to be trying to update and move more and more quicker with content. And I'm really excited about that piece of it also. So menopause. What is menopause? It is referred to as a time when a woman's stops menstruating, which is having a discharge of blood 3 to 4 days in the end part of the month, where she has to use pads, and it's the end of the cycle and the start of a new one. And so it's the part of her life where she stops that process, and it affects every woman differently. And again, we're not talking about women with genital issues or just the average woman who has intact women organs and a uterus goes through this process, and the women that don't, that the percentage that, again, we have to have special care for, and we acknowledge that also. The time usually is between 45 and 55. But now we realize that it could be as early as 30. And then again, if the woman's had surgical complications or problems of general uteral nature, pelvic inflammatory disease, trauma, the organs are intact, and that changes this whole cycle too. And we want to understand that, again, a new perspective issue around women as young as 30 can have cessation and move into early menopause. And this could be from cancer and, again, other things. And at least during that time, women experience symptoms, hot flashes, cold flashes, night sweats, emotional changes. And also, I'm covering this, and bless my mom, when she was going through her menopause, she was really, me and my stepdad just had to step back and be quiet. I think that's the best thing that we could do, because you don't know what's happening. You just have to be supportive. And so she was crying at one time and happiness, and it was just emotionally, it was just a challenging time for her and for the family. But so it's one of the times you as a man have to step back and say, you just have to love her, and as she's going through this transition. And again, trouble sleeping too, lots of trouble sleeping. And it's certainly it's from the changing hormone levels. So when women are younger, uh, they produce an egg each month. The eggs fertilize, and the and if not fertilized, they shed the egg and also the blood because there's no pregnancy, and the egg did not wasn't fertilized by sperm, and therefore um, in the cycle. And then the cycle continues. But as women begin to age, the store of eggs gets smaller, and eventually they are no longer able to conceive a child. I think it's like 300 eggs that women have over the lifetime, and that's why women. This is just as women have pregnancies early in life because of the life cycle of the eggs. As the eggs become older, and less viable, it's harder for women to get pregnant. Although with these IVF situations and a lot of the fertility drugs, they're allowing women to have the children past the cycle. Again, this is the whole idea of the cycle and of the life cycle of a woman. And why women are real special creatures, and that has to be acknowledged. I don't think men acknowledge enough that we can't have a child and we can't get pregnant. We can get somebody pregnant, but we can't get pregnant. We can't carry a child for 9 months, for a year. You know, it would kill us. So, and so this change does not occur overnight. In fact, it takes years. Around the age 50 to 55, again, and again, there are women that have cycles earlier, a cessation of the cycle earlier, like age 30, for reasons mentioned. And when the cycle stops completely, this is menopause. Uh, the definition is there's a cessation of the cycle for 1 year with no further no further cycles in a year. So after a year, if a woman doesn't have cycles anymore, then we consider that being menopause. That's why it's important that if she does start bleeding, then she needs to be evaluated for cervical uterine cancer, because at the end of a succession of the menopause, she shouldn't ever be bleeding again. So, uh, and so it takes about 10 years after menopause, and in the menopause society urges women across to say that that's not true. It's an ongoing issue through life. So once in menopause, it's an ongoing issue for women as opposed to a timestamp date on the end of it. And I didn't think about it that way, but it is true. It's another challenge in her life where she's making a transition from premenopausal to menopausal to postmenopausal. Uh, and so it encourages women across the globe to raise awareness about the prevention of chronic diseases at this point, and because it could have extremely negative impacts on women in terms of hypertension, in terms of diabetes, and what's what has to happen is to impact women in terms of what they're eating, the healthiest diet possible, and exercise. Again, all the things we talk about in terms of health promotion and proactive health issues. Um, and that's kind of what this whole story is ending about. Total lifestyle changes, behavioral changes. Um, and that's what's going to not just have a long life, but quality of life. Again, I talk to a lot of people in my career, and as the care changed, folks always were concerned about the quality, not the longevity of their lives. Because they still do the same things they've been doing: skiing, swimming, running. I call my running around a lake now a fast jog, but I'm glad to be able to do it physically. And it's that's what it is. to be able to do the things you've been doing with as much vigor and vim as you've had in the past. I love practicing medicine. I love studying. I love reading. If I ever get to that point, I don't want to do that. It's time for me to stop this. And I think that we have to understand women in menopause, postmenopausal, have special care needs, more heart disease, more risk of fractures, more loss of partner, more depression, more anxiety, more quality of life issues, and particularly if they are addressing a partner who's also having physical and medical challenges. I saw a couple did yesterday, that she was ensuring that his paperwork got sent out. In fact, when I get off today, I got to go get it done. I'm thinking about it right now. But that's the challenge of being a woman postmenopausal, and not only navigating her health issues, but probably the issues of a partner and of children. Saw the special this morning where this young African American woman was having uncontrollable seizures, and the family had to move back in with her because she was at a point where the seizures were so bad she had put her child on the bus and forgot that she had done that, and forgot what she had told her. So they had this procedure where they're doing a radioactive ablation, I think, of the seizure areas, and they were able to map the seizure areas out and ablate them and kind of remove them. And she had had a seizure in a year, was driving and back to work and back to living life. Remember, nearly half the adult cancer deaths in the U.S. could be prevented by making lifestyle changes, the study finds. So as we move into this next phase of education risk medicine, we're going to depend on total lifestyle changes, behavioral changes, activity, food choices, stress reduction to drive our health, to drive our good health. We'll have challenges in our health, like we had a pandemic, and it's still going on. Please get your vaccines. Please get your flu shots. Please get up to date in your COVID vaccines. It's going to cause you a lot less headache. For those folks that are immune compromised, and what I mean by that, older, chronic illness, hypertension, diabetes, a mental health concern, smoker, cancer, you need to do the vaccination series. Because a lot of our medicines don't treat viruses. Some of them, but they don't do a good job. And Paxlovid, appreciate it, glad we got it. We'll always get it for COVID, but it's for a COVID that they had not engineered for. This is a new COVID. This is a new RSV virus. Again, preventable, right? Nearly half the deaths could be attributed to preventable risk factors, smoking. That's why I brought this up. That's something you don't have to do. Unless you were on a plantation in 1619, you were, some of the earlier pictures of black women with corncob pipes. I remember my grandmother having a coffee can with brown stuff in it. Now I realize it was, she chewed tobacco. That was her spittoon, excuse me. So I'm just on a side. I always find it interesting that this is just for the men. Men can be okay with mothers having you, feeding you, taking care of you, protecting you, but you don't think a black woman can lead you. That's the dynamic. Again, this is where I say it's 1619 and it's the plantations and slave issue. and it's how we are divided, in which one group can have a discussion around an individual that shirks the law and has been found guilty of in the court of law, but we would hold that person to higher esteem than a black woman that's been nothing but straight up, as best she can in an all-male world. See, that's the dynamic. She's had to function in an all-world male world. And this is not political, it's just clarity. We need clarity. If young men are intimidated by the fact that the women in their world are going to school, are working, driving their cars, taking vacations, then get on the same line with them. Because they're working real hard. I see it every day. Anyway, this is Education the Best Medicine, Medicine Hour. I want to thank you all for listening and watching. This is Believe Radio, 24-hour inspirational gospel channel. Again, on November the 16th, the Alameda County Food Bank is going to be the recipient of a fundraiser called Feed the Bay Laugh Fest. It's going to be at the Henry J. Kaiser Center on 10th Street. Look online for the tickets. Brother Earl is running this piece. He's one of the very, entertainers, along with Kyle Newport and all those guys that put these pieces together. I really appreciate them. Marcelo and Kenny Pitts too. Kenny, I know the shop is going where you got to come on the show. I will again want to thank you folks for coming in and watching and listening. And please, please, please be nice to each other. Please be more accepting of each other. Please, let's stop. Let's stop the bickering. Let's work together. If people ask me how I'm, I say I'm a black man in America. So, what do you mean by that? I mean, wow. If since 1619 my ancestors have survived this, I'm a black man in America. Because we had to survive this, and the men in my world had to survive. Had to survive. They had to thrive. Anyway, that was one of the pleasure things. Smoking and alcohol was one of the things they did to relax, to take the pressure off, so they wouldn't come home and beat the kids up and the wife. They beat themselves up. And that has to stop too. Self-abuse has to stop. Again, I want everyone to have a great week. Drive careful. Be safe. Take care of one another. Share the love. Honor your ancestors, because that's whose shoulders we stand on. And again, I want to thank everyone for supporting Believe Radio and 24 Hour Inspirational Gospel. We're growing. The dynamic is changing. A few more shows coming on board. Happy about that. And want to try to relate this to the fact that, tobacco is a killer of Americans. It's a killer times 3 or 4 to African Americans and people of color. The data is real clear. We suffer more. We get less treatment. They discover our cancers later. We get treated later. So that's why I want this to stop. want to say goodnight, everybody, and I want to thank you guys for watching, and we'll see you next week.